From Tampa Bay's #1 news station, this is the Fox 13 News at Noon.
Charley Belcher is up next with a look inside a high-tech simulation lab, training the next generation of hospice nurses.
Good afternoon, I'm Charley Belcher coming to you from Bradenton today from Tidewell Hospice Nurse Simulation Lab. Tidewell Hospice, part of Empath Health, and Empath Health oversees many different hospice agencies throughout the state. But here at this facility where Tidewell Hospice nurses are trained, they've got a state-of-the-art simulation lab here that really helps them get the training they need. I want you to meet Anita Smith. She is the Director of Clinical Education for Empath Health. First of all, the specialty of a hospice nurse, it's really different from a lot of other nursing specialties.
Yes, it is. We manage symptoms at end of life, and I can tell you that in nursing school curriculums, the nursing students, new graduates, do not get a lot of hospice experience in that curriculum. So this is a very important lab for all nurses and all clinical disciplines because of that.
And nursing is trying to figure out how to save a person and keep them alive and then go home and be happy, and the hospice care is about being with that patient through the end of life. That is just the good outcome that it's going to be.
Yes, we want to provide quality life at the end of life and figure out what matters most to that patient and their family.
So, almost impossible to train every scenario, but doggone it, you guys are coming close to doing it with this lab right here and a very specialized mannequin. Don't call it a dummy. It's a smarty, if anything. We're calling him Jim today. Tell me how this is an important tool for teaching nurses.
This is an important tool because Jim, our mannequin, he allows us to show the normal physiology that our body would. So you and I have heartbeats and lung sounds, and he has the same. We can program all the heart and lung sounds to whatever disease process we want. Say, for example, you had pneumonia, your lungs would sound kind of rattly. We can make his lungs sound kind of rattly.
He can cough.
Yes.
He can speak.
Yes.
Even if his eyes can change colors and look around and blink, and you could put a little yellow in there if he might be dealing with a jaundice issue, or you can really manipulate the scenario so a nurse will learn what to look for and how to react to what they see.
Yes, exactly. We can.
And the environment as well, from dirty dishes and a roach in the sink to anything else around the room. Explain why that's an important component to this simulation lab.
It is an important component because a lot of the things that we see in the room here are safety issues. So, you know, when we're in our patient's home, we want to be able to notice some of the things that are there. For example, Jim has a cigarette in the ashtray here, and he also wears oxygen. That is a huge safety risk for fire hazard. So some of those things would allow us to notice that, and we would have to educate him on why that is important, that he doesn't smoke.
So you want to make sure your student notices that.
Yes.
Points that out.
Absolutely.
There's a nursing shortage everywhere, I'm sure in the hospice nursing world as well, so hopefully this might inspire someone. If you're in nursing school right now and thinking about a specialty, or if you're thinking about a career change and going to nursing school, we certainly hope people will consider becoming a hospice nurse, right, Anita?
Yes, I hope so.
Yeah, and for more information, you can certainly reach out to Empath Health or Tidewell Hospice. Thank you for explaining this to us, and important work going on at the hospice nurses. It is certainly a very special specialty. Pardon the redundancy there. I think it's accurate. Charley Belcher, Fox 13 News.